Hi, my name is Sahar Jamal, and I'll be on NTV Kenya on the One Health Lens podcast. I'm the founder and CEO of Maziwa Breastfeeding, and today I'm going to show you the Wema breast pump.
Hello, welcome to the One Health Lens podcast, where we talk about everything from global health to public health and the road to universal health coverage. I'm your host, Dr. Dana Wangari Gitao. In studio with us today is an innovator, an entrepreneur, talking about a very important topic, breastfeeding, right? I mean, we constantly hear World Breastfeeding Day, and we sort of just commemorate the day, right? But yet this needs to be a continuous conversation. And this is why our guest today is here with us, telling us why she's doing what she does and why it's important. Hi. You can introduce yourself.
Hi, my name is Sahar Jamal, and I'm so happy to be here. Thank you for having me.
Okay, so Sahar, I've heard and I've read of maziwa before, right? And any Kenyan or any Swahili speaker will know what maziwa is, milk, right? So one can guess it's around milk and milk production, I'm assuming. But what do you do exactly? What is maziwa?
Yeah, so we celebrate the magical powers of breast milk, specifically Maziwa ya Mama.
Yeah.
And we support breastfeeding mothers specifically between the trade-off between staying at home to breastfeed and care for their child and returning to work to support their families financially.
Yeah.
And the way we do this is with something called the Wema breast pump, which is a discrete wireless and portable pump that can be used in any workplace environment, and with a network of community breastfeeding ambassadors that provide practical lactation support for mothers.
Okay, maybe let's take a step back and I'll speak from a clinical practice perspective. Typically, the mother's given birth, right? And one always imagines that's the biggest hurdle. Then the baby is here with her. And you find the mom saying, hey, I have milk, but I'm struggling to feed. Or I'm breastfeeding, but, there's pain, there's all this, right? And often at times, I find it to be a heartbreaking moment whereby after, say, 9 months, right, probably cesarean delivery, and the mom is saying, I'm tired, It's not the easiest story, right? And so in that case, right, maybe you can maybe let's even start with you first, right? What made this an important problem to solve, right? What's your backstory, right? What's your backstory?
Absolutely. Yeah. So I was working in a somewhat similar setting, maybe more in the PNC postnatal care realm of things at an organization called Jacaranda Maternity. And we were encouraging mothers to breastfeed. Many people will have heard the phrase exclusive breastfeeding, whether or not you're a mom. It's been really hammered home to moms and to Kenyans for decades, really. And so me, as someone who is not a mom, my job was to go and talk to hundreds and hundreds of moms about exclusive breastfeeding. And it was very funny because even when there was a language barrier, even when there was not a full understanding between the groups that I was speaking with and me, people would always use the phrase exclusive breastfeeding. And we would say, okay, well, how long have you been exclusively breastfeeding? And they would say 6 months. Yeah. And it became almost like a script, right? Because moms don't want to feel bad about their choices. Yes. And what I learned is that sometimes when we're focusing so heavily on awareness and education, we're forgetting that, we're making moms feel guilty and shameful about their choices. And we have to be very careful about that if we really want to get the honest truth about how difficult it is to continue to exclusively breastfeed for 6 months. And in that journey, I really started to feel a little bit bad because I'm sitting there telling them what to do without recognizing that many moms are working 10 hours a day. They're taking a matatu an hour each way to their jobs. They have no physical ability to continue exclusively breastfeeding for the first 6 months. Most of these moms are working in places that don't have maternity leave, that don't have lactation support, which is mandated by the government. And I just recognize that whether it's breastfeeding or otherwise, mothers and women are constantly being penalized for their reproductive capacity, when really we should be celebrating moms for this huge responsibility, right?
Absolutely. I mean, I get that. I get the guilt that comes with motherhood as well, right? It is on one hand, you're meant to be a supermom, right? You're meant to juggle both professional and you're meant to take care of this newborn as well. And you find find that you don't have a lot of community support, right? And even in terms of your options, maybe you could look it up online, but always you want someone who's tried something, or it's at least commonplace to have this discussion so that you can quickly ask, say, your doctor, you can ask whoever it is that, what are my options? So I like that you do mention the fact that it is an awareness, but it's also moving the conversation around not just this is what has been prescribed, but it's really what works for you as a mom, right? And so then this is where Maziwa comes in terms of the options that you provide to women who give birth, right? Mm-hmm. So then, what are these options? I know there's the breast pump, but what's different about the breast pump, first of all?
Yeah. And so just to start with the problem that moms face, I think there's two key areas. Yeah. For moving from education and awareness to practical support, there's one challenge where people assume that breastfeeding is natural, and as soon as you have your baby, it's like chop chop, easy, right? Yeah. And actually, it's a learned skill. Yes. And I think that people who haven't had children, or maybe men, may not realize that as soon as you have the baby, there's some training required. And as much as most clinics are encouraged to try and get the mother to initiate breastfeeding within the first hour, often the hospitals and clinics are not fully equipped to do so. And so sometimes there's challenges from the very beginning. If there isn't challenges in the very beginning, there's often challenges maybe 3 or 4 months down the road, because this is when mothers typically might return to work. They'll be leaving the home more. They're not sitting like a cow that's being milked all day 24/7. They have to at least have a life, right? Whether it's work or otherwise. And so that's the second challenge, where the idea of breast milk expression is actually not very common here if you look at the mass population in Kenya. And if you compare that to the Western world, let's say, 75% of moms in somewhere like the US would use a breast pump. In Kenya, it's 7%. So there's some kind of gap here. It could be about affordability. It could be about accessibility. But our hypothesis is that it's really about the fact that most products don't work for the typical workplace settings that Kenyan moms face. And so most of them require you to have a private room that you can be fully exposed in. They require constant access to electricity. They require refrigeration. And all of these things are not so common in some of the workplaces that many women might face. Like
even at home sometimes,
Right. I mean, KPLC, it's not always reliable. So we have launched the Wema breast pump, which is portable and wireless. You can see it's not plugged in right now, but it's working. It's discreet enough to fit underneath clothing. So it has these collection cups that go underneath your clothing. So you don't have to be fully exposed. And we sell a breast milk cooler that can be used to store the breast milk. And so it tackles the key main challenges that women face, whether it's in their workplace or whether it's whenever they leave the home and are not able to feed the baby directly.
So then in that case, and let's like to hear what the feedback rather has been, right? And I always imagine that it's a journey, right? Being an entrepreneur, there's what you started with versus some of the hypotheses you had, which some of them you've described, and a few years down the line. So what's been the feedback down across that sort of journey, right?
Well, the first and most important thing to say is that we really co-created the product with Kenyan moms. So I was working at Jacaranda in 2018. From basically 2019 to 2021, we were developing the product along with women. So we talked to hundreds of Kenyan moms about their key challenges. We tested our prototypes with mothers. One of my favorite examples is a mother who was a construction site worker. And she actually used one of our early prototypes while painting a house. And, you can imagine it, construction site.
Are you saying you can actually utilize it while you're working? You don't have to be seated in a lactation room, no?
I mean, ideally, we encourage moms to take a break, to take some time to look at a picture of their baby, for example. So we're not trying to discourage moms from taking a break. And it is part of Kenyan law to get an hour of protected breastfeeding time. However, it is possible to use it while working. So people have used it in transit, have used it clearly while on a construction site, all kinds of environments. So a lot of that testing gave us our early feedback. Then we launched this product, and overwhelmingly, we had pretty good feedback. I will say that breastfeeding is a very subjective experience, and every mother is different. Some people will think, oh, the suction is very, very strong, and some people will think, oh, it's not strong enough. And so ultimately, we encourage moms to combine direct feeding with pumping, and that's the ideal situation, that they feed directly when they're home and then they express when they're away from the home. But, you know, some women have said this is the best breast pump in the market.
Yes.
Most women who've used our product have managed to balance breastfeeding and working, which is very exciting news. And then I'll also say that this is Gen 2 of the product. So we've added a couple of little things in the second iteration.
Yes.
We added a belt clip that you can clip onto your jeans, or we added breast milk storage bags as opposed to bottles, just based on mothers' preferences.
Okay, perfect. So then I would imagine before I even go to the price points, because that's always the next point.
Sure.
I would imagine you do not retail these products do you retail them across facilities? What kind of facilities?
Yeah, so we retail them across stores and pharmacies. We're in a lot of the Biashara street stores. We're at Peekaboo. We're online at My Dawa and a lot of other baby shops online. At the moment, we are working with a lot of hospitals on recommendations. From what I understand, the hospitals don't have very large pharmacies where they retail. So we haven't gotten too many contracts in the hospital itself. However, at the typical places where moms would shop for baby stuff, we are available.
Okay, perfect. So then that's only one part of the story, right? The product is really not even the solution, right? So then because we've talked about stigma, we've talked about different elements around breastfeeding support, right? And from what I understand, you bring in different holistic elements, right? What's the additional element?
Yeah, there's a couple of aspects to that. So for those who purchase the product outright, each mother who buys one gets a free lactation consultation. So they're able to access an expert lactation consultant and speak to her for 45 minutes to an hour. And the value of that is about $5,000. So before we even get to the price point, the value of this consultation itself is quite high. We also provide education through our network of community breastfeeding ambassadors. And that's the way that we reach some of the most underserved moms. So these are moms that maybe wouldn't be able to purchase the product outright, but still require this support. And there are two components of that program. One is we partner with county governments to recruit these ambassadors, and we train them for 3 days on the basics of practical lactation support. They go out into their communities and hold mother-to-mother support groups where they help moms with their basic challenges of breastfeeding. The second component is that they actually distribute products like the Wema pump, and they can offer to rent the pump to mothers, which means that mothers can actually use it for 3 months, 6 months, however long they need, pay monthly, and then return it back to us. We then replace all the plastic parts, so it's completely safe and hygienic, and rent the pump again to another mom. So this allows it to be accessible and affordable to the mass population of moms who is also facing this issue.
Yes, absolutely. I like two parts there. So one, the working with county, because, most people will say you hear of different solutions, you hear of different innovations, but they tend to be concentrated, like most healthcare services and specialty type of services in urban centers, right? So you've mentioned counties, you've mentioned also the whole community support, right? And I mean, most of the mothers in Kenya, you'd find that are in rural areas, they cannot even afford to travel to a healthcare facility, right? But what you find, and this is back in the day, I used to work in Kisumu, Kakamega region, and you'd find that the only way you could reach these mothers was you educate a group that's able now to work within the community groups, right? Because you'll always find they'll aggregate, say, during church time, during, there's a certain event, right? Whether it's just the weekend as well. And so the community network, I think, is key, right? But going back to counties, which counties are you working with, actually?
So we've just piloted with Makueni County and Vihiga County, and we're training a network of 200 ambassadors through those areas. So we have one a little more central and one in Western as our initial start. But our goal is to reach many of the counties across the country and empower a network of breastfeeding ambassadors that can go out into their own communities, that understand the cultural myths, that understand the challenges that moms are facing. They can do it in the local language and are really able to reach moms in a way that us as a company would never be able to do without a grassroots network.
Yeah, absolutely. And what are those numbers like? So you said you're targeting training 200 ambassadors, but in terms of reach, what do you project? So currently this 200 would be able to reach how many mothers, for example?
Yeah, our estimate is about 30 30,000 mothers.
30,000,
Yeah. So each, and per year. So each group of mother support group is about 30 to 45 women every given 3 months, because they do a 3-month long kind of mother support group program. And that means that an ambassador could hold maybe 4 cohorts per year. And so the reach is really exponential. You know, they're reaching thousands of mothers per year.
Absolutely. Absolutely. And in terms of the training curriculum, because that's the other question around quality, is this developed by Maziwa itself or in partnership with the curriculum? Who's developed the curriculum?
Yeah, so we use the MOH approved, Ministry of Health approved curriculum. We're not trying to recreate the wheel around breastfeeding education. Our lactation educator who leads these sessions is one of the founding members of the Kenya Association for Breastfeeding.
Yes.
And so she's an expert that's been doing this for 11 years. So not only are we not recreating the wheel and we're using approved curriculum, we also have an expert in the field who's kind of managing the quality assurance.
Okay, perfect. So let's, before you even, I'm avoiding this price point and saving it for the...
happy to answer that,
because I always think sometimes we fixate so much on the price that we forget the value, right? So maybe the other question I have for you personally, right? It's being an entrepreneur is not easy. It comes with sacrifice, right? It's never that, you know, unlike say corporates where you can easily take out a loan, it's personal sacrifice, it's financial, right? What has been your journey, right? So that in many ways, you're able to say this is dedication. You left Jacaranda Health, right? Regular paycheck, right? You saw a need, right? What has been your personal journey?
So I guess initially I should say that I was working at Johnson & Johnson. I was working in their UK office, and I got involved with their CSR work as a CSR lead for the UK organization. And during that time, I learned a lot more about their efforts in maternal and newborn health. Now, my family is Tanzanian Indian, and so I've always been passionate about global health. And as much as I felt like I was making an impact as my CSR lead role and in my day job at Johnson & Johnson, it wasn't enough for me. And I really felt that I wanted to focus on the areas where mothers and newborns need the most support. And that's why I actually started working at Jacaranda Health. And so I did really leave a very cushy corporate job. So while I'll say I certainly don't make nearly as much money as I did before, I think the fulfillment that I get from the work that I've been doing for the last few years cannot compare. But there is sacrifice. I think in some ways it's a luxury to be an entrepreneur. If you are trying to make ends meet for your family, it's very difficult to then take the risk of starting an organization. So I think one other thing that I'm passionate about outside of my work is empowering female entrepreneurs, Kenyan or East African female entrepreneurs to start organizations, to access funding, to access mentorship, because I've been fortunate to receive some of that along in my journey. And so I'm hoping to give back in that way as well. But I won't lie and say that it hasn't been a sacrifice. I just think that, you know, when you're working at a big company, maybe you are not seeing the tangible impact of what you're doing on a daily basis. And I feel really fortunate that I have been able to. And yeah, nothing can compare to that.
I imagine. You do have some big names behind you, right? Some big partners behind you, right? You've had some successes. Maybe mention those.
Sure, absolutely. So we've been very fortunate to raise grant funding from some of the bigger grant funders. So the Gates Foundation, something called MIT Solve at the university, an organization called Grand Challenges Canada, the Acumen Fund. And so, you know, over the years, we've managed to raise grants to support our growth. As I said, we're a social enterprise. Our profits from the sale of the Wema breast pump are reinvested into our community programs. In terms of other partners, we've been very fortunate to start working with the IHRM, which is the Institute for Human Resource Managers. And we're actually hosting a webinar with them at the end of the month to celebrate Women's History Month, but also to talk about the gaps that there are in workplace support for mothers, especially related to breastfeeding. So it'll be the MOH, IHRM, Maziwa, and the Kenya Association for Breastfeeding coming together to talk about where we could probably improve our workplace support. And we also have corporate partnerships with several large employers of mothers to disseminate our corporate package of our breast pump.
Okay, perfect. The big question, how much is the pump?
Yeah, sure. I mean, happy to share.
Yeah.
It's $13,500 on our website.
Oh,
And I would argue that that's relatively affordable compared to a lot of the double electric breast pumps available.
Yeah.
And then at retail, the price might be a little bit here or there, maybe a little higher, a little lower, depending on the retailer's price point.
Absolutely. So what else, what are the other options out there in the market for the pump? What most people would say, I use this, right? So what are the other options and how does your breast pump compare to the others?
Yeah, there's kind of three main categories of other options. One is a manual pump. So people might use the basic manual pump where they have to use their hands to express. You would express one breast at a time. Some of them are significantly cheaper because they don't have the electric motor. But of course, there's a sacrifice in value, to your point on, value for money. If someone tried to do that at a workplace, they would need at least 45 minutes to be able to do both breasts. It would take time. Of course, there's no storage involved. So there's some compromises if you choose to use a manual pump. Then there's a category of electric double pumps, some of which require to be plugged in to the wall while you're expressing. And so again, that would require access to a private lactation room where you'd have to undress, put the pump on, and be plugged in. And then finally, there's a couple of new wearable sort of pumps that have come out that are generic. And my understanding is that there's a compromise as it relates to customer support. Usually the people who've launched those products are not present in the market. And so our value add compared to those kind of maybe lower end, lower price point companies that have come in is that we have 24/7 customer support. We speak to you in Swahili. We're able to respond to your questions, and we provide the lactation support. So we really believe that the WEMA provides a combination of an innovative technology that's discreet and portable, but also that localized customer engagement.
Absolutely. I mean, I think the key there is really the support, right? It really is the support. It's not just you being a consumer or a buyer of a product. It's really saying you're entering an ecosystem, right? Where they could walk the journey with you, right? From baby 1 to baby 4, 5, wherever it is. You have a partner you can always rely on. You're saying there's lactation consultation at the beginning as well. I think the question I'd have would be, are there plans in the future to obviously expand the program, right? But integration and collaboration with the government, right? Because it always goes back to that, right? So that it's not two systems, but how do you collaborate and how do you see it in future complementing, say, universal health coverage programs that have been rolled out, community health providers who have been hired and all this. How do you see that both from a government collaboration effort and then from a Maziwa perspective as well?
Absolutely, yeah. So I think there's three key ways we can work with government. The first is what we're already doing, which is recruiting and training a network of ambassadors that come from the existing government networks. As you know, with devolution, the counties really own a lot of this healthcare support that's being provided. And so we work directly with each county, go into the sub-counties themselves. In fact, our team is going tomorrow to Makwene to do a training with Makwene sub-county. And so that's something that we've already started. The second one is advocacy around public policy. And I think the example of the webinar that I had mentioned on March 27th is a good one, where we do have a participant from the MOH in that conversation and the IHRM, like kind of private sector HR managers, to discuss how can we better support moms in formal workplaces, at least, if not informal workplaces.
Absolutely. Let's not forget you being on this show is part of the advocacy as well.
Absolutely, and like happy to do this more and talk about this issue, because I know it's something that moms are talking about, but it just needs to have a little bit more airtime, right? And then the last area I think is around just thinking about insurance. And of course, there's two aspects of insurance. There's public insurance and there's private insurance. I think the first step is probably around private insurance. So when you're talking about, universal healthcare coverage and things like this, of course, improving the system more broadly will rise all tides in some ways. But from a private insurance point of view, a breast pump is actually a very good investment for insurers because it prevents all kinds of health issues. You know, a baby who's breastfed is 14 times less likely to die and, you know, have all these kinds of illnesses like stunting and malnutrition and diarrhea. And the mom also faces a lower risk of cancer and diabetes. So this preventative intervention is actually a pretty smart investment for an insurer to cover. And most insurance providers here don't cover breast pumps.
They don't.
So, you know, when we think about government and public insurance, that's probably a longer term solution, you know, maybe with Linda Mama or something like that. But in the short term, I think private insurers should consider it as well.
Absolutely. And in terms of your own projections as Mazur, right? As they always say, 3 years from now, 5 years from now, where do you want to be?
Our focus for the next 2 years is to expand across Kenya. You know, we've reached about 25,000 mothers and children so far, which is exciting.
Exactly.
However, we're still scratching the surface. There's 1 million moms who give birth every year. And so our goal is to deepen our relationships with the counties, to expand our rental option and our corporate package, which are very unique ways of delivering the product to people who may not be able to afford it outright. And to, geographically expand across the country. So that's our kind of short-term goal. In the next 5 years, we are looking at new markets. So we've done a market assessment for a few other countries in East Africa. As you can imagine,
Tanzania is,
you know, Tanzania is close to my heart. Absolutely. We're also looking at Rwanda, Uganda, and the likes. And so that will be in our pipeline for the next 5 years. But we want to make sure we have a sustainable way of scaling and that we have a model that works in Kenya that we can replicate across the board. But as you can imagine, so many countries across sub-Saharan Africa, even South Asia, Latin America, face very similar challenges with the working poor population where, you know, there's so many moms who are working that are unable to juggle their home life and their work life.
Absolutely. In terms of, I think, sustainability, and you've mentioned this, right? Because there's always the talk around NGOs, even social enterprises coming into a region, right? Working on a certain program, in this case, the lactation support program. Then say funding doesn't come through, they have to either downscale, downsize as the case might be. And then, you know, mothers are left hanging in there, right? So maybe to just, because someone is going to watch this and say, oh boy, there's another program, or, you know, how people might just talk. So in terms of sustainability, what measures do you have in place to say, if you're in Makueni, if you're in Vihiga, right, you're working on this process, this method that ensures that the program is sustainable?
Absolutely. So there's two main components of that. The first is working with the counties on programs that already exist. So there's something called BFCI, which is the Baby Friendly Community Initiative, that already has a network of CHPs or community health practitioners that are leading these mother-to-mother support groups. So where we come in is purely capacity building. We come in to ensure that the people who are leading the groups are actually familiar with practical lactation support. What sometimes happens is that many of these health workers are given theoretical training, but are not given the hands-on support that they need. People laugh when I say hands-on about breastfeeding, but truly it's about techniques about expression, attachment, positioning, where they can actually guide the mom, help them hold the baby, help them express the milk in a way that goes a level beyond just education awareness, where they're not just hammering home exclusive breastfeeding. They're talking about practical needs. And so where we come in is capacity building for existing networks. So even if we didn't get funding, or even if we moved away, those networks are already trained, and the BFCI initiative is already implemented in these counties and will continue. Of course, there's challenges with county government funding as well, and we hope that, you know, some of that resolves itself over time. But the good news is that now CHPs are getting stipends. There is a bit more of a formalized approach to doing some of this training and education. So that's very exciting for us, because then we can come in as an additional supplementary support from a capacity point of view.
I like that capacity point of view, because then, as you said, I mean, there's already a network being formed, and who knows, a few years from now, Mazur will also be the capacity building, the go-to capacity building provider for most counties, right? I want to ask one final question, right? Aside from when are you coming back? But what would you say is, most people would say, what's your final message, right?
Sure.
But what was that, and you might have highlighted it initially, but what was that moment, right? You're at Jacaranda. You've been Johnson & Johnson, Jacaranda, right? And maybe let me even give you an example, right? For me, it's always, they always say that women can have it all. And I always say no. I always say that it's a factor of priorities, right? There's no mother out there who can give birth today, be back to work tomorrow, 8 to 5, still breastfeed, still take care of the child, finish work assignment. You can't do it all. You cannot, right? And I don't say this in a negative light. I say this as an encouragement to mothers to say that it's okay to take time. It's okay to ask for help. It's okay to say, this is my priority for the next 1 year. It's my priority for this time period, right? Because it always breaks my heart when the pressure women just place on their shoulders, society, community, but the guilt they face, right? So for you, what was that one moment, if you have, or what's of that situation that always brings you back to say, you know what, say the time, the next county will say, no, we don't want you here. What keeps you going?
Yeah, I think what really keeps me going is the memory of the conversations with moms where they're very well aware of what they need to be doing. Yeah. They know, they've heard, exclusive breastfeeding. Yeah. And when you see that look on a mom's eye where she's like, okay, well, thank you for telling me that my baby is at a higher risk of death because of my choices. Yeah. But what do you want me to do? Like that desperate, guilty look is so painful. And what it always comes back to for me is that this shouldn't be put solely on the mom. This is not a woman's issue. Whenever I say I run a women's health organization or a breastfeeding organization, sometimes people check out and, specifically maybe men might turn around and be, okay, it's not really related for me.
Yes.
I try and emphasize that our organization is supporting the future generations of African children. The population in sub-Saharan Africa is going to be the majority of the population of the world. Yeah. And so these moms who are nourishing and raising these children are literally creating the future population of the whole world.
Absolutely.
And how are we celebrating and supporting them instead of making them feel guilty and shaming them?
Yes.
And how are we as a society thinking about this as an investment into our future? And that is something that should be relevant to everyone.
Absolutely.
And so when an employer is thinking about, okay, should I invest in the corporate package of Maziwa? Should I put in a lactation room? Or when a government is thinking about, should I engage you as a lactation support group? Or when a funder is trying to think about whether they should invest in Maziwa, what it comes back down to is this larger idea that mothers who are here, who are feeding their children, are setting up the foundation for our future global society.
Absolutely.
And it's not fair for us to put that onto a mom. It's not fair. Whatever decision she decides to make, if she recognizes she can't have it all and she's trying to trade off one or the other, it shouldn't be her responsibility alone. No mother should have to choose between her baby's health and her family's economic well-being. We know that even when a mom earns an income, more of those shillings go towards the community and the family than her male counterparts. And so we know they're really the backbone of society. And how are we as a system supporting these moms, especially in this critical part of their journey?
Absolutely. Thank you so much. I look forward to having you again with Mom, an ambassador, because this is a conversation we need to continue having, right? It's not just about mothers alone. It's a wider society issue, right? We're talking about the future generation. It's not just about breastfeeding. Thank you so much.
Thank you.
Thank you for joining us on the One Health Lens podcast, and we'll see you next time.
So the Wema breast pump is unique because it's a discreet, wireless, and portable pump. It can fit right underneath your clothing, unlike other breast pumps that have a bottle that sticks out. So you can put it right underneath your shirt and pump on the go or at the workplace. It also has a battery-operated motor that can work without being plugged into a socket and can be charged overnight, just like your phone. And it comes with a breast milk cooler that you can purchase, which has an ice pack in it that keeps the breast milk cool. I hope you enjoy the podcast.